Why mycoplasma or why M.hyo? M.hyo is considered as the primary agent of the enzootic pneumonia in pigs. Mycoplasma infects the epithelium of the respiratory tract of the pig, and it causes damage in this epithelium. We consider that mycoplasma is an enhancer of the so-called porcine respiratory complex,
because of the concern that mycoplasmas have in the production phases. Although they're not regulated, they cause some great economic implications. So with that, we recognize mycoplasmas that are involved in several species, or there's several species of mycoplasma, as we say, that are involved with pigs, and their virulence varies quite a bit with that. We also recognize that we find them everywhere in just about every country as well. So our focus was going to be primarily on the 4 mycoplasmas: Mycoplasma hyopneumonia, which we know causes lung lesions and is of great importance in production phase; Mycoplasma hyosinoviae and hyorhinus, which also cause some lameness and of great implication in the field for the veterinarians and producers. And then we included Mycoplasma flocculare because we recognize the cross-reactivity, although Mycoplasma flocculare by itself is not recognized as really creating big problems in pigs.
Serology is a very useful technique. We are proposing a new ELISA. This ELISA is based on a structure of indirect ELISA, but by using 2 antigens. One antigen, mycoplasma antigenic fraction, which is considered as an antigen negative, and high-enriched specific fraction that we consider a positive antigen. The idea is to use both in the same plate and then to subtract from the positive reaction the negative reactivity in order to obtain an indirect ELISA, which is more specific, and in these conditions maybe it could be more sensible.
So our purpose was to not only test serology, but at this time there was the development of the oral fluids that was also being implemented, and to see if we could detect some antibodies via oral fluids as well. So we sought to measure pig antibody response and the level of cross-reactivity in serum and pen-based oral fluids after challenge with the 4 species of swine mycoplasmas. And then serologically evaluating the commercially available assays that we had at that time, there was question about how much cross-reactivity. And again, these are CD pigs, and we got just 4 pigs per group. These assays do start to detect a lot earlier. So day 8, we started to get some positives. And then you can say a little bit of variability on how well some of them responded or how quickly they turned seropositive.
In the first trial, we worked with samples coming from a trial of experimental infection, known negatives that were vaccinated on day 0 and revaccinated on day 21, and then they were infected on day 70. The animals were bleed on day 0, 21, 42, 70, and 88. The animals were vaccinated with different groups, with different vaccines, the normal vaccines present in the market, and there were also some groups who were not vaccinated and infected, and not vaccinated, not infected. These samples were categorized in 3 different status. Status corresponding to not vaccinated, non-infected, only vaccinated samples coming from animals, only vaccinated, and samples coming from animals vaccinated and also infected. In terms of sensitivity and specificity, we observed that no kid has any specificity problem, and but in terms of sensitivity, the differences were mainly focused again in the vaccinated samples. The samples coming from vaccinated animals were detected with a sensitivity of around 70 with ELISA, around 40 with TIP test, and below 15 with ELISA. Vaccinated and infected, the agreement between these kits was absolute, and in this case, the results were poorer. We are moving to the samples in the field. In this case, we defined a panel of samples, thanks to Maria Peters from the University of Minnesota. She selected a group of farms that, from the historical status or from their knowledge, they considered that it could be classified inside these categories: vaccinated, infected, vaccinated, not infected, not infected, not vaccinated, not infected, and not vaccinated, not infected. The samples coming from Minnesota, from South Dakota, and from Iowa. The idea was to test the three kits again by using this new panel of samples coming from real conditions, not from the lab. In this case, for this analysis, maybe the only conclusion was that we obtained by FIP test only 6 samples inside the doubtful category, by the indirect ELISA 12 and with C-ELISA 49. It means that we're more consistent results with the FIP test. If we move to figures of sensitivity and specificity, in this case, the best sensitivity was obtained with the FIP test, followed by I-ELISA and C-ELISA. To have a better sensitivity by using the C-ELISA, we have to use the second cutoff, the low cutoff, and in these conditions, the results were better than this, but in these conditions, the kit begins to have some problems of specificity. It seems that then for FIP test or I-ELISA, the specificity was the same by using the 2 cutoffs.